Good morning. Welcome to Anne Arundel County's Town Hall on Coronavirus in our virtual environment. I'm Roz Hamlet. I'm the County Public Information Officer for the County Executive. With us today are County Executive Stuart Pittman, who's navigating this county through a very trying crisis. Our County Health Officer, Dr. Nilesh Kalyanaraman, is focused on the overall health of the county and keeping everyone safe. With us today, we also have Ms. Karnitra White, our Director of Social Services, who is pursuing every opportunity she can to assist people who are in economic need and protecting vulnerable children and adults. We will also hear important updates from the community from Bishop Antonio Palmer of Kingdom Celebration Center, who's joined us. His people are feeding literally thousands and thousands in West County. And we also will hear from Ms. Rosa Cruz, who will give us an update on the world through a county business lens. We thank everybody for joining us. So we have about an hour to squeeze in a lot of information and answer as many questions as we possibly can. This morning we're live streaming on Facebook, but we're also broadcasting on cable access channels, Verizon Station 38 and 98 Comcast. The program is also being recorded by NAV, and it will be broadcast later. NAV is our important community partner there. We'll begin with remarks from our county executive, who will be followed by Dr. Nilesh and Ms. White. A gentle reminder, folks, please don't touch the microphone. And after they're finished, we're going to start our Q&A period. County Executive.
Thank you, Roz. So last night, I was notified that an Anne Arundel County man, whose name I do not know, lost his battle with COVID-19. We want his family to know that we are sorry for their loss. We are here for them, and we will pursue this struggle in his memory. So COVID-19 is infecting Americans at a faster rate than it has grown in any other country. We don't know how many Marylanders are infected because test results come in 4 to 7 days after the swabs are taken. And only one other state has fewer numbers of reported tests taken. So in Anne Arundel County, the infection rate is doubling every 2 or 3 days. Our hospitals are doing the responsible thing and canceling effective surgeries to make room for a patient surge. Efforts to add hospital bed capacity are underway, but progress is slow. We were asked yesterday by the state to identify hotels and other large spaces where convalescent care could take place, and that work is underway. So without widespread testing and without either a vaccine or a cure, we are left with one strategy to slow the spread of this virus. Every single one of us must act as though we are a carrier of COVID-19, because even without symptoms, we could be. Social distancing and isolation are not how most of us want to spend our spring and even part of our summer. And nobody is happy about the economic impact of this battle. But this is where we find ourselves, and this is the challenge that we must meet. However, this is not the end of the world as we know it. Life continues, and we can adapt. We can even find joy and appreciate the good things around us. And speaking of good things, I am very lucky to have with me today, not too close, but still with me, some very, very good people. Dr. Nilesh Kalyanaraman is the leader that our heroic health professionals need in a time like this. He is always on the job, he always tells the truth, and he is always on our side. Karnitra White leads our social workers. She understands the struggles, the people they serve, and she understands the stress that they are under as they work to protect our most vulnerable residents, the ones who don't have the resources that it takes to get by at a time like this. And Rosa Cruz is here, representing the team at our Economic Development Corporation. She is in regular contact with our small business people, many of whom are unable to pay their employees, unable to pay on their loans, and unable to pay their rent because revenues don't exist for them right now. And my friend Bishop Antonio Palmer of Kingdom Celebration Center in Odenton, not far from where the stores at Arundel Mills Mall and Live Casino employed thousands of people until just last week. Like many churches in our county, Bishop Palmer and his parishioners are doing God's work through food distribution and services for all. I want to share some good news. Some good news from what most of us would say is an unlikely place. Some good news from the United States Congress in Washington, D.C. We heard last week at this event from our very own Congressman Anthony Brown. Earlier this week, I spoke by phone with both Congressman John Sarbanes and Dutch Ruppersberger. But it was Thursday night that I heard from both of our Maryland senators, Chris Van Hollen and Ben Cardin, after they took what was an old-fashioned economic stimulus bill and turned it into a carefully targeted aid package that actually puts money where it's needed to help our county residents who are losing their jobs and their income. The Coronavirus Aid Relief and Economic Security Act, CARES Act, is 800 pages and $2.2 trillion in programs, so I won't get into the details. But this bill will have a real impact on our residents, on our hospitals, and on county government's ability to act locally where we need to act. Consider this. Unemployment insurance will be available to hourly and self-employed workers who were ineligible before. And on top of the scarce money that they get to cover their costs under today's limits, everyone who files will get an additional $600 per week. To apply for unemployment insurance, go to Maryland Department of Labor's website. Traffic is high, so please be persistent. But there's more. Even if you don't lose your job, the federal Treasury wants you to spend money. So they'll be depositing $1,200 into your account or sending you a check for that amount, unless your adjusted income is over $75,000, in which case the number declines as your income rises. You also get $500 for each child. There's plenty of money in this for large and small businesses in the bill as well, but in this case, that can work. There's a rule that they can't get the money if they lay off more than 10% of their workers, and much of the money is a taxpayer investment that will have a return when these businesses bounce back. Anne Arundel County is projected to receive as much as $99 million to offset our emergency coronavirus spending, and there is a direct assistance to hospitals, homeless assistance, and student loan deferment in addition to that. To some people, all of this federal money might sound extravagant. I worry about the national debt as well. But there is a sound economic case to be made that this investment will pay off, not only for American families, but also for the federal Treasury. We are saving our people and we are saving our economy. One of our challenges as a local government is to effectively take advantage of what the federal government is offering. We have the smartest, hardworking people in local government anywhere, and they are spending this weekend making plans to pursue every dollar of these funds that we can get for the residents of our county. Before I turn over the podium to the other speakers, I want to skip through a few highlights of what we've been doing this week. While county government buildings are closed to the public and all staff who can work from home are working from home, county government continues to serve our residents. Police, fire and EMT, public works, budget and finance, law, health, social services, mental health agency and crisis response, planning and inspections and permits, central services and purchasing, our housing authority. I could go on and on through every agency. But my point is that the work continues and the people in these agencies are creatively adapting what they do to serve our residents in ways that they never expected just a few, what seemed like very long weeks ago. Here are a few examples. You might want to grab a notepad and a pen to write down some phone numbers and some websites as I go through some of this incredible work. Attendance at county parks is up 35% from this time last year, and that is a good thing. We have waived fees at our regional parks, but please practice social distancing, and don't use our parks as gathering places. You will be asked to disperse if you do. On the childcare front, since our first town hall, actually, I promised free childcare for the children of our essential employees and healthcare workers. We plan to offer this service in schoolrooms where childcare is provided by our Rec and Parks team when school is open. We were delayed when the state of Maryland made a decision that counties could not do childcare in our schools. So this week, the state closed all private childcare centers, but told them that some would be approved to reopen next week to exclusively serve children of businesses and agencies that have not been shut down, including essential businesses and stores. A list should be available of those sites at marylandfamilynetwork.org or by calling 877-261-7856. I know that they're building that list as we speak. But our team at Rec and Parks developed an alternative plan so that we could get started quickly and meet what we expect to be a very high demand. Yesterday morning, the state approved our plan to open 2 separate rooms for 8 kids each at our first 3 sites. Those are South County Rec Center, Arundel Swim Center on Riva Road in Annapolis, and North County Aquatic Center in Glen Burnie. We put the application information online midday yesterday, and by the end of the day, those 48 slots were filled. One single mother who works in a hospital told our staff through her tears just how grateful she was to have a safe place for her daughter so that she could get back to the job she was trained to do at a time when she is most needed. Rec and Parks is working on a plan to open senior centers for childcare this week and will continue pressing the state to allow our team to use our childcare rooms at schools. Parents can contact Rec and Parks Childcare Division through its website or by calling 410-222-7856. Parents will pay nothing for this childcare. The cost will be reimbursed to the providers by the state. Our call center here at the Emergency Operations Center has received 1,800 calls and is working hard to get information to every caller. The number here is 410-222-1600, and I urge you to use this number. You can also email them at eoc@aacounty.org. Our winter relief program has been extended. Local churches alternate sites in our county to provide shelter in the winter to people who are homeless. That program would have ended this week, except for the generosity of Bay Area Christian Church. They have stepped up to extend the program, and an email was sent yesterday to all county staff asking for help staffing the site. So thank you to everybody who signs up for that. Note that we have a ban on evictions, foreclosures, and utility shutoffs in effect. We are in the process of expanding our mortgage counseling program at Arundel Community Development Services. At Anne Arundel County, at aacounty.org/coronavirus, you can now access an interactive map of all free food distribution sites in the county, including the school meals program, the senior nutrition program, and food pantries. You can also access on that site a listing of special shopping times for seniors at grocery stores. The Senior Nutrition Program has adopted a new service whereby a week's worth of easily prepared meals are available every Tuesday from 11 a.m. to 1 p.m. at all of our senior centers. Aging and disabilities and volunteers from other county agencies continue to call 10,000 of our seniors each week, and some daily for a check-in. Thank you to the crews doing that work. Our health and social service teams continue to visit all assisted living homes and homeless shelters and other sites where vulnerable populations are housed in close quarters to do testing for symptomatic residents, provide guidance on social distancing, and in some cases, provide alternative housing at local hotels. Our Anne Arundel County Public Schools team is continuing to innovate. My 2 fourth-grade boys have been online each day doing the lessons that are offered as quickly as they can get them done. Superintendent Arlotto announced yesterday that there will soon be programming that is more interactive and more comprehensive and more time-consuming for the kids. So my message to the kids is that this is your opportunity to take charge of your education. Do the curriculum that is offered online, but also explore what you're interested in. Take some time to practice your writing skills. In fact, I could use some straight talk and wisdom from kids right now. So please send me an email with your concerns and your ideas at countyexecutive@aacounty.org. I won't be grading the emails, but I will be reading them. As layoffs spiked and unemployment claims increased 30-fold in our county last week, our team at Workforce Development is stepping up to help find work. The big box stores and some industries are actually still hiring. So go to aawdc.org to get their virtual help finding work at an essential business that is working to meet the needs of our residents. I know that many of you are eager to help. You can offer your time by calling EOC at aacounty.org or the number here at 410-222-0600. Hopefully that number is sinking in. You can also donate supplies. A list of needed items is now at aacounty.org/coronavirus. Our drive-through donations management facility will be fully operational on Tuesday morning. Please call the number here, which I won't repeat, to let us know you're coming, but be aware that the site is at 1370 Blair Drive in Odenton and is open for donations only from 10 a.m. to 2 p.m. Monday through Friday. You can also donate the same supplies to Anne Arundel County Food Bank at 120 Marbury Drive, which is at the old Crownsville Hospital site. They are open from 9 until noon, and 1 to 3 Monday through Fridays. And finally, if you have financial resources to contribute, please consider the Coronavirus Response Fund at Community Foundation of Anne Arundel County. You can donate online at cfaac.org. So last week, I encouraged you to breathe, to get outdoors and enjoy the spring, to read a good book, connect with family, and take care of yourself. I hope you've done some of that, and I hope you're getting good at it. This will go on for a while. It will get worse. People you know will get sick, and some may even die. When you look back on this time, I want you to have no regrets. I want you to believe that you did what you could. You protected people and you helped someone. You acted in a way that saved lives. If enough of us emerge this summer or fall having met that challenge, I can guarantee you that we'll find ourselves in a better county, in a better country, and in a better world. So I will now turn it over to our health officer, Dr. Callie Naraman.
Thank you, County Executive, and good morning, everyone. As I'm sure many of you are following, the numbers of people who are infected both in our county and the state continue to grow. We are now just about at 1,000 in the state and at 88 in Anne Arundel County. And last night we were informed that the first person in Anne Arundel County to died from COVID-19, and our thoughts are with their family. At the same time, there are many people being sick and hospitalized, and I want to share that. You know, we talk about the fact that there are a lot of people who don't have symptoms and are walking around, but this disease takes its toll on everybody. We particularly look at those who are vulnerable, those who are older, those who have chronic illnesses, those who are homeless. But when we look at what's happening, we see that of the people being hospitalized, half of them are under the age of 50. They may not pass away, but this is a significant burden. This disease takes its toll on people across the age spectrum. And as we go on, there will be more and more people who are going to get severely ill from this, and we need to be thinking about not just those who are most vulnerable, but also all of us, and how we are each taking our place in this and doing our part. So as much as we've made a lot of changes in the past 3 weeks, and I think back to, it was just 3 weeks ago that we had our first case here in this state, and just a little over 2 weeks ago in this county, and the world looks different, there's still more that we need to do. We still have to go shop. We still have to go do those things that are needed to get through our day, but we still have room to think about how we do that. If you're going to a store and there's a line outside, that's not the time to go. If you're going to a park or another location and there's a gathering, now is not the time to have that. And it's hard. It's hard to think about how much you've changed and yet that there's more to do. But that's what each of us can contribute to this situation to make it better. We've gotten questions about what happens during Easter or Passover or other religious gatherings. And the sad truth is that the virus doesn't care about any of that. The same things we talk about in terms of social distancing and good hygiene and avoiding gatherings are still true. We don't get to change the rules of the virus. And so I ask you to think about how you can observe these holidays in a way that's safe and in a way that will help ensure that all of you will stay safe during those holidays. We get asked about funerals and births, and just last night, my sister-in-law delivered healthy twins, and my wife and I were talking this morning about how we wouldn't see them for months, probably. It's hard. All of us are affected by this. And our goal here is to do the things we need to do now so that we come out better on the other side of this. And so I think the best way to think about this is not as if you're trying not to get sick, but instead to think about it as if you are already sick, and how do you keep from spreading it to others? As a test, if you cough out in public, you know you will get looks now. Why? Because people know that they need to keep their distance, and it's hard for us to do that. So think about how you would not pass it on to others. That's the social distancing we talk about, keeping 6 feet from others, avoiding gatherings, infection control, making sure that you're hand washing, using hand sanitizer if you don't have access to soap and water, disinfecting frequently touched objects. These are all still key things that we need to be doing every day, and more so of that. At the same time, we have the opportunity to think about, what is it that I can do? If you are in a position where you're able to offer help, do so. Reach out. There are opportunities to volunteer safely so that you can help your neighbors. And if you need help, ask for it. This is the time that we have to band together, and we will be stronger, and we will come out of this better if we stand together. I'm going to turn it over to Karnitra White this time to talk about how we've been doing that in this county and what you can do to be a part of that.
Good morning, everyone. I know this is uncertain times for many of the customers that we serve at the Department of Social Services, and I want to assure you that we are continuing to serve our customers and looking for ways to ease burdens of persons who may be impacted by COVID-19. We provide at the Department of Social Services many economic benefits, including temporary cash assistance, SNAP, commonly known as food stamps, as well as medical assistance. We have seen an increase in the need for our benefits over the last 2 weeks, to the tune of 42% increase of applications for economic benefits. And we encourage persons to go to My DHR Benefits to apply for either temporary cash assistance, food stamps, and if you're in need of medical assistance, please go to myhealthconnection.gov. You also may contact the DHS call center at 332-6347. Once again, if you're in need of economic benefits or if you want to know how to apply for economic benefits, those applications are available on mydhrbenefits.dhr.state.md.us. We also have some news for our current customers who are receiving benefits. If you are currently receiving SNAP benefits, food stamps, and have a redetermination that falls in the months of March, April, or May, you will be given an additional 6 months certification, and you'll have 90 days in which to return all of your verifications. And we're asking you to either mail those in to our offices or to go online and upload your verification. And if you don't have access to either way to do that, you may drop off your applications in our secure drop boxes at our Glen Burnie office as well as our Annapolis offices. Also, for customers who receive temporary cash assistance or TDAP benefits, you too, and you have redeterminations that fall in the months of March, April, or May, your redeterminations have also been extended for an additional 6 months without closing. We want all of our TCA and ABOD customers to know that we have waived the requirements, the work activity requirements, for 90 days. So please do not report to your work sites. And if you've applied for benefits, you will have 90 days to return your verification before any adverse action will be taken on your case. In addition, medical assistance has been extended for an additional 30 days. We hope that all of these actions will help to ease some of the anxiety that our customers have about whether or not their benefits will continue. As you can see, these have been put in place so that your benefits will continue without being closed. If you have questions, once again, you can call the DHR call center at 1-800-332-6347, or you may go to My DHR Benefits and find out information on your case. We're also working to ensure our most vulnerable population, those who are unsheltered, have access to shelter. We're in regular communication with our shelter programs and assessing their needs during this crisis. If you would like to volunteer to assist us, please contact the county, and we will be looking for assigning persons to volunteer. We continue to respond to all reports of abuse and neglect for children as well as adults. And I want to thank my staff of the social services who continue to work to meet the needs of the citizens here in Anne Arundel County. Many are still having to go out into homes and respond, and many are teleworking and coming into the office. I also want to thank the citizens for your continued trust in our team during this challenging time, and ask for your patience as we work to process the increased number of applications that we're receiving. Together, we will all get through this. And now I would like to turn it over to Rosa Cruz from Economic Development.
Thank you all for your time today. Anne Arundel Economic Development Corporation is the business engagement arm for Anne Arundel County. And as you can imagine, over the last 2 weeks, we've had a number of businesses contact us for assistance. So I just want to take a few moments today to let you know of the many resources available to help you, to help our entrepreneurs and our small businesses that have been impacted by by the COVID-19 pandemic and to let them know of the updates and the resources that are available to you. As the county executive said at the top of the town hall, there is some good news. Yesterday, lawmakers on Capitol Hill, as well as the president with the stroke of his pen, approved a more than $2 trillion stimulus package called the CARES Act. And I just want to briefly highlight three important aspects of the CARES Act. As you can imagine, our team is poring over the more than 800 pages of this legislation to make sure that we extract all the benefits and understand all the benefits for our businesses. But three of the big highlights are as follows. The Payment Protection Program, which I call the PPP, is a program that would provide cash flow assistance through 100% federally guaranteed loans to employers who maintain their payroll during this emergency. So that means if you maintain your payroll, your loans would be forgiven, which would help workers be employed, obviously, and it would help effective small businesses in our economy snap back quicker after the crisis. PPP has a host of attractive features, such as forgiveness of up to 8 weeks of payroll based on employee retention and salary levels, no SBA fees, and at least 6 months of deferral with maximum deferrals of up to a year. Another aspect of the CARES Act is a small business debt relief program. This program will provide immediate relief to small businesses with non-disaster SBA loans, in particular 7A, 504, and microloans. Under this program, SBA will cover all loan payments on these loans, including principal, interest, and fees, for 6 months. This relief will also be available to new borrowers who take out loans within 6 months of the president signing the bill into law, which was yesterday. And then there is the economic injury grants and economic injury disaster loans. These grants provide an emergency advance of up to $10,000 to small businesses and nonprofits, private nonprofits harmed by COVID-19 within 3 days of applying for an SBA economic injury disaster loan. Now, what is really great about the CARES Act is that it fills in a lot of gaps that we have talked about, that we've heard from our business community. So it does provide relief for self-employed, government contractors, nonprofits, and it extends assistance to things such as payroll loans and grants. I want to talk to you now about the state programs that are available through the Maryland Department of Commerce. They are a very important partner to Anne Arundel Economic Development Corporation, and we have tried our best to promote these state programs, which Governor Hogan announced last week. The state programs are for Maryland-based businesses with under 50 full-time and part-time employees or a Maryland manufacturer. The first one is the Maryland Small Business COVID-19 Emergency Relief Loan Fund. It's a $75 million loan fund for for-profit businesses only. It offers no interest and principal payments due for the first 12 months. It then converts to a 36-month term loan of principal payments with an interest rate of 2%. Then there is the Small Business COVID-19 Emergency Relief Grant Fund. This $50 million grant fund for businesses and nonprofits offers grant amounts of up to $10,000, not to exceed 3 months, of demonstrated cash operating expenses for the first quarter of 2020. The third is the COVID-19 Layoff Aversion Fund. This will support businesses undergoing economic stresses due to the pandemic by preventing or minimizing the duration of unemployment resulting from layoffs. So the award, which would be up to $50,000 per applicant, would be a quick, deployable benefit and customizable to your specific needs. And then if you are a manufacturing business, please take note that there is the COVID-19 Emergency Relief Manufacturing Fund. It's a $5 million incentive that helps Maryland manufacturers produce personal protective equipment that is urgently needed by our hospitals and healthcare workers. Now, there are other state updates that are important to businesses as well. For those of you who are worried about your tax filings, take note. The Comptroller's Office has extended the filing and payment deadlines for personal and corporate income taxes until July 15th, and most business tax payments until June 1st. Also, if you are an LLC that typically files your annual reports on April 15th, the Maryland State Department of Assessments and Taxation has extended that deadline as well to July 15th. The Maryland Department of Labor and our Anne Arundel Workforce Development Corporation are great partners if you are a business that is dealing with workforce issues. The Division of Unemployment Insurance at the Maryland Department of Labor has seen a lot of traffic, obviously, but as the county executive mentioned, please be persistent and please be patient and continue trying to reach their call centers for your questions related to your workforce and as well as unemployment insurance information for your employees. The Anne Arundel Workforce Development Corporation, a great partner of ours, is also going to try to help to let the community know of job opportunities. So if your business is looking to hire permanent or temporary positions, AAWDC can get the word out about these opportunities. So please do check out our partners at their website at www.aawdc.org. And a few other resources that you should know about as businesses. The Maryland Healthcare Connection has extended their enrollment. So in response to this crisis and to prioritize the health and safety of Marylanders, a special open enrollment period has been opened for uninsured Marylanders. Also, as many residents in Anne Arundel County and throughout Maryland are working remotely, cybersecurity may become an issue as bad actors try to infiltrate our computer networks. So the Cyber Association of Maryland has established a cybersecurity breach incident hotline for businesses or individuals that fall victim to a breach or need guidance. And lastly, I want to reiterate that AAEDC, through two very important partnerships, provide no-cost counseling to businesses. The first one is the Maryland Small Business Development Center. And this organization is committed to providing sound advice, consulting, and supporting our entrepreneurs and our small businesses. In fact, on Tuesday and Thursday of next week, between 1 and 2 p.m., they will be hosting a webinar on all the provisions of the CARES Act, and that information will be on AAEDC's website. Another free counseling service is SCORE, which stands for Service Corps of Retired Executives. They are retired managers and executives and business owners that can really mentor business owners through this time and give them some helpful guidance, particularly with the SBA programs that have come online in the last few weeks. Now, this is a lot of information, we understand, but please, if you're a business owner, feel free to make Anne Arundel Economic Development Corporation your first stop for guidance. Our website is arundelbiz.org. Check out our newsroom with the latest updates on all these loan programs and additional resources. But if you can't find what you're looking for, or if you have an additional question, please fill out one of the numbers of contact us boxes throughout our website and shoot us your question, and we will respond as soon as possible. And once again, that website address is arundelbiz.org. And we look forward to serving you and assisting you. Thanks.
Good morning, Anne Arundel County, and the wonderful citizens of the state of Maryland. I am Bishop Antonio Palmer from Kingdom Celebration Center in Odenton, Maryland, and Vice President of the United Black Clergy of Anne Arundel County. I'd like to say thank you first to County Executive Stuart Pittman for this opportunity to give an update on our food drive in West County. What churches have done in Anne Arundel County can serve as a model for other counties to follow. Through our partnership with Anne Arundel County Partnership for Children, Youth, and Families with Pam Brown, Diana Taylor, Taiwan Thompson, and others, for the last 3 weeks, we have served families from all social economic backgrounds, all ethnicities, and all walks of life. The first week we served approximately 1,600 individuals. And the second week, we served about 1,900 individuals. And then just this past Monday, we were able to serve over 2,000 individuals. Sadly, we had to turn away about 50 plus vehicles on Monday because we ran out of food. At each food drive, we distributed 8,000 pounds of food, which was donated by Maryland Food Bank and True World Group. In addition, we had 500 prepared meals donated by 4 restaurants coordinated by Monica Alvarado and Ryan Sermons from Arundel Connecting Together. People came from near and far as we served people from 41 zip codes. Some came from as far as Accokeek, Maryland, and also the Eastern Shore. Although people were in line for food, the need was greater. Some were unemployed, others furloughed, and some even homeless. Many spoke of the uncertainty of how their bills would get paid. However, we were honored to be able to put a small dent in their frustrating situation. We want to thank Kingdom Celebration Center church family and the 40 plus volunteers who served in different capacities. Some bagged the foods, others set up tables, some served the food, while some pastors also from the United Black Clergy were there also to lend their prayers as those who would ask. In addition, we had licensed mental health professionals there to assist us. We had volunteers from different churches and civic organizations, as well as our elected official, Delegate Mike Rogers from District 32, and the Western District Police Department. I want to share that our next food distribution will be this upcoming Monday, March 30th at 10 o'clock a.m. at 1350 Blair Drive in Odenton, Maryland. Again, that's this upcoming Monday, March the 30th at 10 o'clock at 1350 Blair Drive in Odenton, Maryland. For more information, please give us a call at 410-672-2006. Again, that's 410-672-2006. Or you can visit us on Facebook at Kingdom Celebration Center. Again, I say thank you to all and hope to see you. If you're in need, please stop by. I would turn this back over to the lovely Roz Hamlet.
Thank you, Bishop Palmer. So nice to be called lovely these days. So let's begin the portion of our program where we accept questions. The questions are coming in live on Facebook now, but as I get my computer sort of set up to take a look at that, let's start with the subject that is foremost on everyone's mind, and that is testing. testing. We've received many, many questions, and Dr. Nilesh, if you would begin to tell us everything you know about testing.
Sure. I figured I would save it for now. Testing is foremost on our minds, and rightly so. It's both necessary to be able to tell for somebody with symptoms whether they have COVID-19 or not, and also for us in public health to be able to see how far it has spread, where it has spread, and how it has spread so that we can better understand what is happening in our communities. So the situation with testing is that there's a lot of work being done. I've said that every week since I've been doing this, and there are some positive signs now. We believe that in this coming week, we will be able to have drive-through testing in our county. We don't know the details yet. We're waiting to get things firmed up, but we believe we will have that at some location, and we'll share that once we know that. It remains the fact that it takes about 4 to 7 days still at this point to get results back. That is frustrating, and I know that that is challenging not just for you, but also for our hospitalized residents, because it's really critical to be able to get that information back. There are efforts being made to improve that turnaround time, and there's some technical improvements, and we're hopeful to see that come through shortly. We continue to prioritize people who are hospitalized for testing and people who are healthcare workers, because it is critical that we know if they develop symptoms so that they don't pass it on to others in that healthcare setting. That's the priority, and that's being focused on within the hospitals. In the community, we're focusing on people who are older than 65, people with chronic illness, people in congregate settings, as we talked about earlier, whether that's nursing homes or shelters, transitional house, group homes, because we want to make sure that in those settings where people are much closer together, where we don't have outbreaks, and that's really critical. And then the next grouping of people is people who have symptoms, people who have symptoms for any of a number of reasons. I forgot to mention that first responders are also a priority of the health department, and we've been testing first responders as well. So that's where we are with testing. Unfortunately, I don't have much positive news yet, but we're very hopeful for this week.
So what, for average people who are not first responders and who don't belong in a category of people who are prioritized for testing, if you begin to feel very, very sick, what happens to get you a test? How do you end up in a car, in a drive-through perhaps, to get a test?
So that's where we're talking about, when we're talking about mild or moderate or severe symptoms, that's really what that's trying to get at. So what's a mild symptom? We get asked that a lot. So the symptoms of COVID-19 are cough, fever, shortness of breath. Mild symptoms are when you have a cough, fevers, low-grade fevers that you can control with medication, and you're able to manage either at home or wherever you are staying. And by manage, I mean you're able to eat some food, keep fluids down, manage your symptoms with medication as needed. As long as you can do that, stay where you are, continue doing what you're doing, and as the symptoms progress, and we see that it generally takes 1 to 2 weeks for the course of infection to run. But if you can manage. Testing isn't going to change what you're doing, and as long as you're isolated, that's exactly what you need to be doing. For people who are sicker, they're having persistent fevers that are difficult to control with medication, are lasting more than 3 to 4 days, but they're still able to manage. That's a good time to call either your doctor. You can call the health department. We shared that number earlier. It's 410-222-0600, and that's the EOC number, and they can direct you to the health department. That's the time to call to get some advice as to what to do next, and we or your private doctor can help assess where you are and what you need to do next. And if you're having severe fevers that you can't break, that you're having shortness of breath, that's when you're having severe symptoms, and it's time to preferably call up the emergency room before you go, but you can certainly just go to the emergency room if you're having those symptoms. As the testing situation changes, our guidance on that may change, but for right now, that's where we are.
Thank you. You know, the news junkies among us have heard about this finger prick test that is being talked about in various places across the country. Have you heard about it, and what do you think?
Yes. So, one, don't be a news junkie. Read it once a day. It'll drive you crazy. But two, there's a lot of tests that are coming out in terms of rapid tests for COVID-19, antibody tests to see if you've already had it. None of those tests are yet validated, meaning that we know that they're really going to tell us what's actually happening, or B, are ready to scale up. What you're hearing is what you would see in the biotech newsletter chatterboxes. But now we're all paying attention. So we are hopeful, but they're not ready for prime time yet.
Great. And in a somewhat related matter, can you discuss a little bit about hospital preparation? What plans are in place for hospitals and urgent care facilities if we see an increase in COVID-19 cases?
So I have the opportunity to be one of a few health officers who's part of our state's hospital surge planning. And what's being discussed, and I've also discussed this with Anne Arundel Medical Center and BWMC. What's being done right now is a number of things. One is deferring any elective surgeries. Two is trying to separate out those with COVID-19 or symptoms strongly suggestive of that so that we can limit spread. And three, I think people are doing really well in terms of gauging how sick they are and going to the hospital only if they're really sick. And that's decreasing the number of people who are in the hospital at this time. Hospitals are also identifying additional space to increase the number of beds that they have, and generally we're targeting about a 60% increase in beds across the state, and that's true in our county as well. Identifying additional staffing. In order to be able to have more beds, you need more staff, and that's across the entire spectrum. You need med techs and nurses and doctors and pharmacists and registration, the whole 9 yards. And then also looking at how we find hotel space for people to recover, and the county executive mentioned that earlier, how we're working with nursing homes and long-term care facilities to help with getting people out of the hospital quickly. So that entire preparation is ongoing and continues every single day.
Thank you. So let's turn our attention now to our children. We're spending a lot more time with them, hopefully happily so. Maybe we should start with how we're supposed to survive that. Do our kids get to participate in Zoom conference meetings, or should we, bring them as close as we can get them to us, or how do we handle our children?
So that's a great question. If your kids are anything like mine, they are itching to get outside, see their friends, and it's really challenging to be able to. It's challenging to have to keep them inside or keep them away from their friends. Our general recommendation is that we recognize that children do need to be with their friends, but as we've described it, find your island and stick to your island. So if that's 1 or 2 friends, that's okay, but don't expand. Keep your circle really tight. It's the time to get creative. Outdoors games are much better when there's a lot of kids, but that's not something we're recommending. So how do you get your kids outside but not interacting with each other? That's the challenge that we have. Books, board games. I know we tried to buy a board game and it's on like 3-week back order or something like that. And honestly, trying to get them engaged in your household activities. All of our households have changed rapidly in the past few weeks, and seeing how they can be a part of the new rhythms that you have. They find that more rewarding, and you will too.
I've got to weigh in on this one. So I've got 3 kids. I have a daughter who's grown, who lives in Los Angeles, and sheltering in place. And one of the issues there is that they have food deserts worse than we have them in some communities, and they have lines as long as 4 blocks long to get into grocery stores. So that's good news that we're not in that situation here in Anne Arundel County. But I can say that as a parent of a child that does not live nearby, that there is a strong urge to connect. And I was on the phone with somebody last night who had taken a break to talk to me while he was playing trivia with his grown kids via Zoom, which they do once a week now. And I heard a lot of laughter in the background. So I encourage people to use the technology to connect where they can with family that's not there. My 10-year-old twin boys, who are in 4th grade in Anne Arundel County Public Schools, I'm lucky that my wife is home. I've been working from home most of the time, unless I have to come to something like this. And she has been pretty disciplined with these young guys, and they have hours that they need to be doing their schoolwork, doing the curriculum that the school system's providing right now. But a highlight for me was their Taekwondo class. We decided to continue online, and watching my 2 boys doing Taekwondo in front of a screen where there were about 40 other kids with pictures doing Taekwondo on their screens was pretty hilarious. So it's an interesting experience, and I think it'll be different for everybody. And I would encourage people, when they get that $500 per kid, if they don't have the devices, it might actually be worth investing in a tablet or a laptop to get your kids connected so that they can connect with their friends.
Thank you. Our show producer, Ms. Jenny Probstel, is sending me a note that we have 4 minutes left, but we haven't even begun. So let's go a little long today. Let's go to, let's say, 12:15, 12:20-ish. This next set of questions are for the county executive, and they have to do with county services. What measures is your administration taking to ensure that county employees still working in the field, like trash pickup, water distribution, and sewage treatment system staff, remain safe and can still keep these systems running?
It's a challenge. Our public works employees are really unsung heroes. They rarely get the credit that they deserve for what they do. We've been notified by some of the contractors that we work with, including for trash pickup, that they may not be able to meet their contract obligations as far as staffing goes. So if people start to see a little irregularity in trash pickup, that's to be expected. We're going to do everything we can to keep up. In terms of their safety, our central services purchasing has been very aggressive about acquiring PPE so that we have it where we need it. I know that our public works director is also being very strict with his staff about distancing on the job and cleaning hands and all of the things that they can do. For our public safety officers, they also have PPE equipment that's standard issue that they have had already. They do have to, our emergency medical technicians do have to go into homes, and they're keeping their distance, and they're putting on their PPE as needed, so don't be surprised if they look a little bit different. And our police officers have had situations where domestic situations that have been downright dangerous for them, and it's absolutely essential that we keep our public safety folks and all of our essential employees safe so that they can continue to serve the public. But every department has its own plan for that, and we're taking it very seriously.
Great. The next set of questions are intended for Carnitra. They have to do with the most vulnerable among us. This first question is, what actions are being taken to protect people who are homeless?
So we're providing MREs for those persons who are homeless and who are unsheltered. In addition to that, we're working with our shelter providers in the county in order to keep persons who are in shelters sheltered. We've worked with the health department and those providers to ensure that we have the adequate spacing. And then we've also worked with some local hotels and businesses when we needed to move people so that we could have the adequate spacing. Also, for persons who are unsheltered and don't want to come into shelter, we've put in place showers in a few locations, one in Glen Burnie, as well as one in Brooklyn Park, and we'll have one in Annapolis, for them to be able to come in and shower, as well as to wash their hands. And so we continue. If persons are in need of shelter, they may call 410-417-7260 for assistance on getting placement.
Thank you. Again, that number is 410-417-7260. The next person would like to know how to apply for food stamps, cash, and emergency assistance, and how to check on the status of their application.
Persons who are in need of food stamps or cash assistance should go to mydhr.dhr.state.md.us. And if you just do an easy Google search and put in My DHR Benefits, the link should come up, and you can apply online for those benefits. We're encouraging people to go online and to apply. If you're looking at the status of your benefits, you can also go to My DHR Benefits and set up an account with on your current case and be able to look at the status. Once again, I would also remind our customers that we have pushed redeterminations for March, April, and May 90 days, so your cases will not be closed if you had a redetermination in March, April, or May.
Will there be expedited services for SNAP benefits?
There are expedited services for our SNAP benefits if you meet any of the criteria, which includes you having your household income, your gross monthly household income is less than $150, and your resources, such as bank accounts, are less than $100, or your household is a migrant or seasonal farm worker household, expedited benefits will still be available. And once again, if you go to My DHR Benefits and apply, one of our caseworkers will reach out to you to process your application via phone.
Would you?
Can I just add for people who are having trouble keeping track of all of these websites and phone numbers and details, that's why we've set up this Emergency Operations Center, so that there are people here who know all of this information and can guide you through it if you lose track.
Definitely.
The 410-222-0600 number.
Thank you. I would add that I think it's time that Maryland state government simplifies its website addresses.
We're really simple. My DHR Benefits will get you all of our economic benefits.
Okay. What measures are in place to help workers affected by all of the closures and layoffs?
Well, I mean, I can address that. Not enough, which is why it was so important that Congress passed the bill that they passed that will provide the unemployment insurance. And I'm told from people who've called that it's much quicker than it ever used to be, that fewer questions are being asked. Same of the small business programs, that it's easier to access and there's more money available. And so that's the direct assistance to people who've been laid off. But I think when you put all these other programs together, I know it's not going to be enough. There are going to be people who aren't eligible. Undocumented workers probably is the first on that list, who don't have a Social Security number and therefore won't be able to access the federal funds. And but they are also losing their jobs and have zero income. And so we're going to be looking at that at the county level to see what we can do to to add to that. And that's why it's important that we have this additional $99 million coming directly to the county to use as needed for the emergency.
And on a related question, is there a plan to ensure uninsured residents right now so that they're able to receive the proper access to medical care and COVID-19 testing facilities and resources?
So we're, as Carnitra mentioned, there people who are insurable can get access to health insurance. Testing for COVID-19 for everybody is free of charge, whether you're insured or uninsured. And there's processes that we're looking at right now to ensure that getting treatment for COVID-19 isn't an economic burden or a challenge, and that cost isn't a barrier. And so we're working on that right now.
Just to add, persons who are uninsured, Maryland Health Connection has extended enrollment due to COVID-19. So you can go to the Maryland Health Connection webpage and apply for health care if in need.
Thank you. So some of us have seen these crazy videos that are on Facebook about people fighting, getting violent over rolls of toilet tissue. Mr. County Executive, will we be enforcing crowds at the grocery store to keep people 6 feet apart in line?
The grocery stores can certainly call the police department, as can residents, when they believe that the order to prevent groups of more than 10 from congregating is being violated. So the police department is available if needed. I think it's going to be up to each store to keep order within the store, that we can't change that. That's the way it is.
We have a question now about the rate of hospitalization in the county. How many have there been? Does anyone know how many hospitalizations there have been?
So in terms of hospitalizations in the county at large, there's actually fewer people who are being hospitalized now, and those are the active efforts of the hospitals to clear space for what's coming in the next few weeks. In terms of the number of hospitalizations that are in the county, it's a little bit hard to measure because people from any county could be in the hospitals in this county, and people from this county can be in other hospitals. So in general, what we're seeing in the state it's just short of 1,000 people who've been confirmed with COVID-19. We have seen about 220 hospitalizations. So just a little bit above what we would expect. Looking across both the country and the world, about 20% of people are getting hospitalized, and we're at about 22% in the state.
I was just texted some numbers that weren't being put out by the state until, I guess, today or maybe yesterday. They stopped reporting negative test results on the 12th of March, and they've started again, which is very important so that we know how many people are being tested. So the number that I was given is confirmed cases is 992. Number of negative test results is 11,516. So that's the total negative since they started. Still a very low number.
Wow, that's good news. I think that you've answered this question in another way, but it bears repeating. What should people who are delivering food from restaurants and groceries do to protect themselves?
People who are doing that should, of course, always maintain, make sure that they have hand sanitizer on them. We're encouraging people to pay by credit card, either on the phone or if you're ordering online, to do it that way so that you're decreasing the number of touches that you have. Of course, if you have to pay by cash, that's okay. But for those who are ordering food, please also make sure that you're washing your hands before you interact with those food service delivery folks. We've talked a little bit about food safety. It's one of the reasons that the health department inspects restaurants to make sure that they're doing food handling properly, but also in the context of how do we make sure that the containers are safe. And so we also recommend that when you get, if you get it, you're going to get it in a bag most likely or in a container, that you recognize that those containers should probably be wiped down when you get them, and that the food itself is safe. It's the containers and what it comes in that can transmit it. And so that disinfection that we recommend for frequently touched objects applies to the containers as well.
Thank you. Our last questions have to do with donations and volunteering. There is seems to be all signs that there's a tremendous pent-up desire by people in the county to help. Certainly Bishop Palmer's work is demonstrating that. So how can residents volunteer to help during this outbreak?
Well, that's been a big question that we've been talking about within the administration. There are nonprofit organizations, there are departments of government that can use volunteer help. And so rather than send people to each organization, we've been asking people to call that same number, 410-222-0600, or to email at eoc@aacounty.org and provide information about what you can do, whether you have a car, what kind of time you have to offer, whether you have special skills. I know that medical personnel are particularly needed, even retired, and I could let Dr. K talk to that. Yeah, we want to know who you are, and then what our team does here is to try to direct you to the places where you're needed.
And I'll follow that up with when we're talking about healthcare professionals. MD Responds is a statewide organization that collects the names of people in the healthcare field who can volunteer their services, and we'll put that link up on our website. And it's a way that we can centralize at the state level healthcare workers so that they can be deployed to the areas that are needed the most.
And I would also add that our COVID Town Hall email address will remain operational. So if you have any questions that you want to ask that way through that venue, please feel free to do so. I think this last question is getting at something that's very important, and everybody has touched on it today. What is your neighborhood level call to action for Anne Arundel residents who may or may not have any prior interaction with neighbors, but who may need to be able to be reached and to be helped?
I would say that there are neighborhood-based organizations that exist, and through our Office of Community Engagement and Constituent Services, we have lists of those organizations. They're obviously not meeting in person, but I know that some of them are active on social media, and they're active. Some of them are having virtual meetings as well. So I would encourage people to try to connect with their neighbors virtually and see if there are things that they can do to help, whether that's providing food for people who can't cook for themselves. At some point, it may be cutting grass. It may be walking dogs. But I think the answer is that people are going to have to connect with each other through social media and through those organizations. So you can go to the county executive's web or the county website and look for community engagement, constituent services. They can get you information about the organizations in your community that exist.
Any final thoughts?
Just one thing for us. I would also like to thank all of our foster parents who continue to work with our children in foster care during this time, and we know that children are out of school and you're engaging them in a different way. And so please reach out to your caseworker if you have any issues, but a heartfelt thank you to all of our foster parents who are working with us and continue to open their homes and their hearts to our children in foster care during this time.
Thank you.
I think now in this time more than ever, each of our actions has a weight that we may not have felt before. And so that's both on the side of how do you keep the social distancing and the infection control in place and acting as if you are already sick. And then the other side of that is how do you help others in need, and how do you do that? Each of you, as we've been talking about today, has different skills and talents and abilities, and how do you harness that to help your neighbors and your community? And so we really encourage you to reach out if you're able to do that.
One of the most beautiful unintended consequences of this is that I think we are each reaching to places that we didn't really know existed. Mr. County Executive, final words?
No, just thank you. We're doing this every week. Do this on Saturday again. Dr. K's got Wednesdays, 3 o'clock. 3 o'clock. A health department virtual town hall as well, focusing on health issues. And please get in touch, stay in touch, connect. We need to communicate with each other, and we'll do everything we can.
Thank you.